Hi, my name is Helmut Flasch. I'm going to talk to you about the question I get always asked, and that is, I have been told to do community activity to get more new patients. I have done it. It doesn't work. All right. Here's a few things which probably happened, very most likely. You did the wrong community activities. You didn't do enough of them, and you expected patients to come in immediately or not so immediately, but you expect them to come in and say, I came because of this community activity. I saw you there, blah, 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 da, da, da. It's rarely going to happen. Sometimes it does. Just this morning, I had a client of mine telling me that a priest sent him 3 or 4 people, comes with his own family as well, only because of a community activity he did about a week ago. Rarely it happens like that, but it does happen. But what happens is the community starts loving you if you do community activities, and here's the thing, a lot. How often? 8 to 10 to 12 times a year. Now, you're probably by now shitting in your pants because you go, I never have the time, which is another of those things. It takes too much time. It doesn't. The community activities we are going to let you do and show you how to do, they are not time consuming. A little bit from your staff, but very little. Mainly it's boiled down to sending out letters to the right people. Who are the right people? Fire chiefs, police chief, and when I say chiefs, I mean the whole department. Priests, rabbis, Buddhists, school teachers, and the media, of course, community leaders such as city hall people and all those type of people. And any and all non-profit organizations in your neighborhood. Hundreds of them. Actually, you also send those some of those informations to other doctors, to other business owners, and all kinds of little things. So there is more than you can possibly send. They need to know that you're doing the community activities. They are in the community involved. A business owner, a doctor, a chief, a school teacher, a rabbi. They will spread the word about the community activity for you, which is something you need to do, not participating in Rotary Club. That's not a community activity. Yes, Rotary is there for community activity, and I love them as what they do, but most of you join for getting more new business, and it's not a community activity as such. And even if you help raising them $3 million for poor kids in Africa, it doesn't matter. It will not go on your record as a personal person. Participating in the multiple sclerosis things, all those organizations which are wonderful, and you should participate in them if you love them, they're not going to get you new business. You need to be a king in your own corner, do your own little activities, which you can learn much more about. This data on advertise.com/free. Here's the thing. You got to be a king in your own corner. You do your activities. Your staff will organize them. Of course, they have a check sheet. They need to have a check sheet what to do. The work is extremely little. It's extremely little for each event. For you yourself, the work is less time than you will spend every day doing nothing. And it doesn't matter how busy you are. You might think that there is never a time you do nothing. I am telling you, those activities take less time than you now spend doing nothing every day. And by do that, I mean doing nothing in your office every day. I'm not saying at home and that type of stuff. So, on advertise.com, you get a little bit more of that data, and you get many other informations which all cooperate. The whole thing is a synergy. And if community activities are not used in synergy with many other activities, forget it, it won't happen. See you on the other side.